It's been nearly a year now since St. Peter's Health Partners reversing course on the planned closure of the Burdett Birth Center, a plan that resulted in the Attorney General getting involved and, in the end, a multi-million-dollar grant from the state helping support the facility to keep it operational for the next 5 years at least.
The grant comes with stipulations, though, and tonight News 10's Trishna Begum shows us the unique approach the center has been using to provide vital care to expecting mothers with better outcomes.
I just want to just take a peek in this.
The maternity ward inside Burdett Birth Center in Troy usually doesn't have cameras rolling in the hallway.
Typical postpartum room. So
but on this day, as a group of expecting mothers walk through to see where they'd be giving birth, News 10 tagged along.
This has been quite a new adventure.
Even though Nadine Baker has been here before, in this same room, in the same rocking chair, welcoming her firstborn back in 2023, this time she's expecting twins.
I wanted my labor and delivery to be very natural and normal and healthy, so I knew midwives, I wanted to be a part of that. Burdett kind of offered like a great in-between.
It was an option she wasn't sure would still be available a year ago.
I was actually kind of trying to figure out what my options were at that point because I knew I wanted something similar, but there's really nothing like Burdett.
Burdett pushed through its challenges. Last April, a state grant helped keep the center funded through 2029.
Burdett never stopped providing that care to that community.
The facility's rebirth remains contingent on its growth despite declining birth rates nationwide. Last year alone, Burdett helped deliver 768 babies.
Success measures, I would say, are off the charts.
With a C-section rate of just under 20%, about 10% lower than the national and state average, and a preterm birth rate 50% lower than the national average, birth outcomes have improved, in part because of a new model of prenatal care practiced at Capital Region Midwifery. The sound approach, called centering, is the only one of its kind in the Capital Region.
The idea there is that everybody is on equal footing in the room, and sometimes there are bias, and that is unfortunate in the healthcare system.
The appointments include women all due to deliver around the same time, creating a community of support.
So the one-on-one care, typically we don't have as much time. And that's really the key to it all.
I think it's comforting. I'm a stay-at-home mom, so being able to get together with other adults, other moms, and realize that, you know, a lot of the symptoms, we're all going through them.
People who are in a group, in a relaxed setting, in a discussion with each other, tend to remember those learning objectives that we talk about and change behavior.
The 5-year state grant also supporting a new doula program within the last year and another critical resource, a transportation specialist, helping Burdett reach more underserved communities.
Public transportation is sometimes very difficult to access, especially if you're talking about weather, you're talking about having other children with you.
The collaborative model driving comprehensive care as transportation needs are identified to ensure better access to appointments.
It could be medical appointment, it could be lab work, it could be specialist appointment.
With Nadine ready to welcome both her babies next month, Burdett hopes to keep delivering on its promise, providing vital care one healthy baby at a time.
It's amazing. I think it's something that any mother that wants to experience this type of birth should absolutely be able to.
Burdett officials tell us they are on track to beat their 2024 numbers, and Nadine is inching closer to her due date, May 17th. We wish mom and babies a healthy delivery and a calm delivery.
Absolutely. All right.